Hepatitis A, Hepatitis B and Hepatitis C, causes, symptoms and treatment. Hepatitis A, Hepatitis B and Hepatitis C are the most common of different types of viral hepatitis. In fact, there are 7 of them in all, and while there's growing awareness about these diseases today, there's a lot we'd like to know about them. For starters, did you know that the word hepatitis has its roots in ancient Greece? And it literally means inflammation of liver. And that's exactly what this type of virus does. Different strains of hepatitis virus, A, B, C, D, E, X and G have been identified today, and some of them can cause serious long-standing complications for patients. However, Hepatitis A, Hepatitis B and Hepatitis C are more commonly observed amongst patients, which is why it's important to know more about the causes for these viral infections and their symptoms so that you can get required treatment at the earliest. Hepatitis A, causes, symptoms, treatment. It's the most widely seen hepatitis viral amongst patients, which leads to inflammation of the liver. Though serious implications of this type of infection are rare, you need to be careful if you have got the infection. This type of virus is transmitted through the feces of anyone who has been infected with this virus in the first place. It takes only a minute amount of feces for the infection to be transmitted. Hence it's very important that you maintain personal hygiene and wash your hands to reduce the risk of this virus being transmitted. This type of infection is commonly found in places where sanitation is not up to the mark and there are sewage-related problems. However, you need to note that it's also termed as a sexually transmitted disease, and requisite care has to be taken to minimize the chances of an infection. Symptoms. It is true that patients who are infected by the HAV virus don't always show symptoms, or they might be seen in a mild form. However, it doesn't mean that their feces might not be infectious to other people. Some of the common symptoms of this type of hepatitis infection include a short-term flu-like condition, nausea and diarrhea. Those who have been infected might also experience abdominal pain and itchy skin. Weight loss and loss of appetite is not uncommon either, while in some cases it can lead to jaundice. Thankfully, this infection doesn't lead to major complications in most cases and clears itself off in a couple of months. Once that's done, you become immune to the virus. However, in some cases symptoms can be extreme and hospitalization might be necessary. In rare cases, especially amongst the elderly, it can be fatal too. Treatment. If you think you have noticed symptoms of this infection in you, then it's a good idea to consult a physician immediately. Your doctor will suggest a blood test, which will show if you have the infection or not. If you test positive for HAV, then you will have to take some amount of care, like washing your hands before cooking, etc., to ensure that you don't pass on the infection to others. You might also be asked to avoid alcohol consumption and foods that are difficult for your liver to process. Highly nutritious diet is recommended. Immunization against the virus is another option that can be considered. The first vaccination lasts for about a year or so, and you can get booster doses that will protect you for up to 10 years. For more information, check our website. Hepatitis A B C D E F G.com